Hello everyone, and it's great to be joining you today. Although unfortunately I can't be with you in person, it's brilliant to see that there are so many people gathering face to face this afternoon after last year's entirely virtual event. And just as technology kept London Tech Week going at this time of adversity, it kept the whole world going too. Before I took on this job, I was working with Harvard University to look at how governments can learn from this pandemic and be better prepared for future challenges. And it was clear to me that our fight against this virus would have been so much harder without the technological advances we've made in recent years. Friends and families wouldn't have been able to stay connected. Many businesses couldn't have kept running, and it would have been so much harder to support our vulnerable. And nowhere has tech transformation proved its worth more than in health and care. We all owe so much, not just to the doctors and the nurses and the colleagues on the front line, but also to the coders, the developers, the innovators that have helped our NHS stay so strong. We developed an online diagnosis service that was able to carry out 750,000 online coronavirus assessments in just one day. We used primary care data to securely create the world's largest analysis of coronavirus risk factors at incredible speed. And we created a seamless vaccination booking system that was visited 80 million times in a single month. Now we've seen what HealthTech can do at a time when health systems around the world were under incredible strain. We must build on that progress that we've all seen and deliver this long-awaited digital revolution. And today, I'd like to share a few areas that I see as critical. First, we need to get the basics right and make sure that the great advances we've seen are replicated across the whole of the NHS and social care. I'm not the first Secretary of State to talk about the importance of this agenda, but I firmly believe that technology, if it's deployed in the right way, can be a great leveller. And so we need to make sure that the opportunities of digital transformation are spread fairly so everyone can benefit. Despite the great progress of recent years, too much of the system doesn't currently have the basics in place, which frustrates patients and makes life harder for colleagues on the front line. 1 in 10 NHS trusts are still largely operating on paper-based systems. And in social care, research shows that 71% of the sector has no digital access to information on the medications of the people that they care for. We need to level up these digital inequalities and embark on the full digitization that is so essential to the long-term sustainability of health and social care. This means shoring up our cybersecurity capability, replacing technology that's out of date, and supporting the adoption of shared care records. Because it's only by allowing colleagues to see patients' information in one place, regardless of what part of the system they use, that we can have a truly integrated system for health and social care. 88% of integrated care systems will have a shared record in place by the end of this month. That's up from 65% just 6 months ago. And when I visited a hospital in Milton Keynes just 2 months ago, I saw what impact this can make for colleagues on the front line. How they can reduce the amount of time it takes to access a record from approximately 15 minutes to just 30 seconds. In care homes, it means releasing over 10 hours of care worker time per care home each week, time that can be spent on patient care. This is why digital transformation is essential. And through our digital framework, What Good Looks Like, we've set clear standards for digital maturity, and we're giving frontline leaders the support that they need to make the change where they work. And this work won't just improve the regular interactions that we all have with our health and care system, but it will also allow us to take advantage of the huge advances in technology that offer so much potential. I used to work in finance, an industry that was transformed by technology and led to the creation of new industries like mobile banking. And in healthcare too, we've seen seismic change already, intensified by the pressures of the pandemic. Over 300,000 people are now being supported in their own home through the use of digital solutions for monitoring their long-term conditions, like the pulse oximeters that let patients measure their own blood oxygen levels at home. Some of these changes were made out of necessity due to the virus that thrived on human contact. But here too, there's a lot that's worked well that we can take forward. For example, many young people told us that they appreciated digital consultations for mental health, as they can complete sessions in their preferred location and they don't need to travel to appointments. I know that not everyone wants to have their GP appointments virtually or arrange their prescriptions through an app, and will make sure they can access care in the way that works for them. But some people do. Just look at the incredible digital adoption that we've seen through the course of this pandemic. The NHS app, which lets you view your NHS COVID pass or book appointments. It now has reached 16 million users compared to 4 million in May. And it's worth reflecting, given this week is also Organ Donation Week, that 1.5 million people have now used the NHS app to manage their organ donation decision, with 265,000 of these registering for the first time. The benefits here are enormous, so we need to give people the choice and take the opportunities that these new technologies provide. It's no coincidence that the 5 countries at the top of the Bloomberg Health System Efficiency Table are the ones that have embraced data and data-driven technologies the most. And there's a lot to do, but we're making great progress. During that Milton Keynes visit, I also saw their surgical robots, and I heard about how they'd become the first hospital in Europe to use them for major gynecology surgery. And we're not just using these technologies, but we're also playing an active role in their development. Our AI Health and Care Award is making £140 million available over 3 years to back some of the technological breakthroughs that have so much promise. The most recent winners included an algorithm that can improve the detection of lung cancer, smartphone apps that can detect warning signs for chronic kidney disease, and a program that can analyze speech patterns to detect common neurological and psychiatric diseases. I'm delighted that over a quarter of NHS trusts and foundation trusts in England are deploying at least one solution that's been funded by the AI Health and Care Awards. But I want to bring even more pioneers to the fold. So we're developing clear digital standards to encourage innovation, and we're removing barriers for local leaders by consolidating multiple funds for tech transformation into one single fund. Every London Tech Week, we see just how much tech talent there is in this country. And I want to make sure that we're working with digital dynamos like you all to bring new healthcare technologies to market and to deploy them across the system. Because this pandemic has taught us so much about ourselves, about our health system, about the opportunities that technology can offer. And as we keep moving on our path closer to normal life, we mustn't lose sight of the advances we've also made and the improvements that we can take forward. So, this London Tech Week, let's all renew our commitment to using the power of technology to make the whole world a safer and healthier place. Thank you all very much, and I hope you enjoy today's event.
Hello, I'm Indra, the Director of the Nhs AI Lab. Today I'm going to give a very short overview of our National AI in Health and Care strategy and a short overview of the Nhs AI Lab. For those of you who don't know, NHSX, we're a joint unit between the Department of Health and NHS England and Improvement, bringing together both policy and delivery. And the AI Lab is essentially a programme made up of 5 different delivery hubs. As you can see here, we stretch across both the regulations, Skunk Works, we have an AI and ethics initiative. We focus predominantly around imaging due to some of the data and the data categorization, and as you may well be aware of, our health and care awards. And underneath the delivery programs, we have 3 supporting programs. So why are we doing an AI and health and care strategy? What's the importance of that? As some of you may know, the lab was set up and was predominantly there to accelerate that safe and ethical development and deployment of AI into health and care. But we're very conscious that we have made those inroads now, and what is next? We want to ask ourselves, how do we ensure that the work we've done today enables us to continue tomorrow? And so working and dovetailing alongside a number of other strategies, such as the data strategy that was released earlier this year, we have formed a strategy within AI in health and care. We're very conscious we need to make it practical and tangible, as AI, artificial intelligence, can sometimes be seen as a concept or something that's still in the future. But we're very aware that today, through, for example, our awards, we've seen some very good technologies, some within, for example, brain imaging, looking at how to improve stroke care pathways, some with remote monitoring, looking at how to detect early kidney disease, and then some of those operational processes. Earlier in the year, we looked at how do you automate the COVID sitrep processing, situational reporting. So a number of these technologies are being used, they're here, they're working in the front line, but how do we then scale those? How do we drive those forward? And how would you create a strategy that really helps those both on the front line in academia and in innovation really drive that forward, which is why we're doing this AI strategy in health and care. So here's our vision. I won't read it out, but you can really see it. It's really about driving forward that learning healthcare system by understanding if we use data, we quantify data and qualify data better, we can really improve the outcomes and really set an example, not just here in the UK, but across the globe as well. And so here's our approach. It's quite a detailed slide, but just to go through it, all of these different areas, the dependencies, principles, and missions really add into how do we push forward our learning healthcare system. We focused on these three areas in the mission: population insights, pathway optimization, and safe scaling, mostly because of the research we've done both with external stakeholders within the lab itself and through a number of academic institutes, for example, Nurio. We have seen that these are the three areas that artificial intelligence, machine learning, models really can make the best impact. And so we're looking here then to go a bit further, get some really good use cases and tangible technologies to move these themes forward. So I'll finish there. Our next steps here is what's next. We're publishing this now over the next few weeks. Please take a look at our website on the Nhs Ai Lab hub, but also the website itself, where we're doing a lot more engagement. You can look at the strategy itself. We'd love to get some more feedback. And towards the early end of next year, 2022, we'll look to publish this a lot more formally. So here's all the details. If you'd like to hear a bit more, the hub details are there below, but also where we're going to be launching this actual strategy. So thank you for listening and take care.